Tasmania will be the first in the country to trial a new GP training model as the federal government seeks to address doctor shortages. Under the model, trainees will be employed by hospitals in Tasmania for the duration of their training. This is opposed to rotating through placements every 6 to 12 months. Joining us live now is Dr. Tim Jackson, Tasmanian Chair of the Royal Australian College of General Practitioners. Dr. Tim Jackson, thank you for your time this afternoon. Tell us, why do you welcome the trial?
Well, look, everyone knows there's a real GP shortage, including in Tasmania, particularly rurally. So I think this will immediately add up to 20 general practice registrars that can go out into country general practice in the immediate term. And long term too, it's going to open up the pipeline for GPs so that medical graduates, when they leave the hospital, instead of losing all their entitlements like maternity leave and long service leave, they will be able to stay employed by the state hospital system, but go out and do their general practice training as they head towards their fellowship.
How dire is it, this GP shortage, particularly in rural areas?
Well, I can tell you there's 99 advertisements for GPs in Tasmania currently, and it's the same all around the country, and particularly it's difficult in rural and remote. We've had some practices in southern Tasmania, down at Dover, in the Central Highlands at Ouse, that have been threatened with closure, and it's been very difficult to find GPs to go out into the country. So this will immediately be able to put up to 20 registrars out into the country. It's going to be brought in July, so there's a little bit of time to work out the finer details.
So it's going to make a big difference in addressing this GP shortage in country areas. How will this new model increase the pipeline? You touched on it earlier as well, but now we're making this change so the trainees can stay in a hospital for the duration of this time. What will that do to the pipeline?
Well, I think it will make it more attractive for young medical graduates when they're, after a couple of years working in the hospital system, and they've got to decide which specialty they want to do. That'll make it more easy to jump to general practice. But that's not the only answer. I think there needs to be dramatic increased funding to general practice in general, because we know that only less than 14% of medical graduates are choosing to do general practice. Well, back in my day, for example, it was up to 50%. And I think that's due to 40 years of inadequate Medicare funding that has meant that it just hasn't kept pace with the cost of providing good service for general practitioners.
How should this trial be assessed to ensure there's no consequences for general practice?
Yeah, well, there's already systems in place, so we need to make sure that no current registrar trainee is disadvantaged, and likewise the practices that will be taking these single employer model young doctors on, need to be made sure they're not disadvantaged as well. The supervision process has already been there for the last 20 or 30 years, so that probably won't be a problem. So patients' health and caring will be guaranteed.
Also, can you speak to us about why it's important GPs build relationships with their patients and it's not just a transaction?
Look, it's super important. I've been a GP over 30 years, and look, I've been able to help thousands of patients and been let into their lives. It's a real privilege and an honour to be able to treat them and take them through, whatever medical things come up. So it's really important that patients do have that relationship with their GP. And we know that if patients have a close relationship with their GP and practice surgery, that they're less likely to end up in hospital, less likely to require acute services, and are going to live a better life and more productive life. And it's also cheaper for the nation. So general practice is the real long-term solution, and it just needs more funding.
So this training model is a great step. You'd also like more funding, but is there anything else you think really needs to be introduced to help tackle this GP crisis?
Really, it comes down to funding on the back of 30 or 40 years of inadequate funding. So there needs to be some dramatic changes so that general practice is funded correctly, so that we can stop people getting sick so they end up in their hospital system.
Yeah.
That's the hospital system end of it that's the costly bit and not sustainable. We can't keep building hospitals So yes, there needs to be more resources headed towards general practice.
Dr. Tim Jackson, we have to leave it there. Thank you so much for your time this afternoon.
Thanks very much.